Hi, my name is Ashley Linder. I'm a sophomore biomedical engineering student doing research with the WVU Institute for Community and Rural Health on the Accountable Health Communities model. This study was introduced by the Center for Medicare and Medicaid Services to support community efforts to address the health-related social needs of Medicare and Medicaid beneficiaries. Health-related social needs such as food insecurity, housing instability, and lack of transportation are indicators of the growing gap between clinical care and community service providers. The Accountable Health Communities model tests the practice of addressing health-related social needs as part of clinical visits, with the goal of resolving Medicare and Medicaid beneficiaries' needs. This study could improve beneficiaries' quality of life overall by helping them address their needs, as well as decrease the rate of preventable hospitalizations that are the result of health-related social needs not being met. Ruby Memorial Hospital was one of over 50 clinical sites at which the Accountable Health Communities model was tested. Eligible patients were screened during their emergency room visits for core and supplemental health-related social needs. The patients were eligible for screening if they were a community-dwelling West Virginia resident and a Medicare, Medicaid, or CHIP beneficiary. Eligible beneficiaries were considered high risk and entered into the study if they had visited the emergency room 2 or more times in the past 12 months and screened positive for 1 or more core health-related social needs. Core needs were housing stability and quality, utility needs, safety, food security, and transportation. Supplemental needs were untreated physical or emotional disabilities. High-risk patients were randomly assigned to either the control or intervention group. 30% of high-risk patients went into the control group, and they received a community resource summary with referrals to services near them that could help them resolve their needs. The remaining 70% of high-risk beneficiaries went into the intervention group and were also sent a community resource summary, but they were also contacted by a navigator who could answer their questions by phone and assist them in resolving their needs by contacting community service providers on their behalf. From the emergency department at Ruby Memorial Hospital, we collected data from 265 eligible beneficiaries. Table 1 shows the demographic information of all the eligible beneficiaries we screened. Of the beneficiaries screened, we found that 59 were high risk, and of those 59, 76% of them were Medicaid beneficiaries. Figure 1 shows the total number of each category of social needs cited by the high-risk group. Transportation, food, and housing needs were the most common, and utility needs were right behind them. As you can see from the figure, 31 beneficiaries reported that they could not reliably reach their work, medical appointments, or other essential places. 26 beneficiaries could not or were concerned that they could not afford sufficient food in the past year, and another 26 either did not have steady housing or their housing had problems such as pests, mold, or water leaks. This indicates that among high-risk beneficiaries, there is no single category that is overshadowing the rest, or one that is being sufficiently met across the board. The last figure shows the status of the cases opened by the navigators for each of the needs cited by the high-risk beneficiaries in the intervention group. Navigators were able to successfully resolve the beneficiaries' needs in 58% of cases, and 29% of cases are still open. Successful resolution of the majority of cases indicates that identification of high-risk beneficiaries in a clinical setting can lead to positive outcomes. The Accountable Health Communities model's implementation at Ruby Memorial allowed navigators to reach high-risk patients, answer their questions, and direct them to services to help resolve their case. The next phase of this study will be focused on identifying the regional gaps between clinical care and community services across the state of West Virginia. The goal will be to build on the findings of this study and find out where we can improve at the state and local level to address the health-related social needs of our Medicare and Medicaid beneficiaries.